I have certainly observed these episodes myself. Like, let's say the baby has been running and panting continuously, it eventually develops into some sort of a cough.
Yes.
Or like you said, when they are playing around or some strenuous activities, basically, that also okay. Interesting that we as mothers don't know what to watch out for. That's why these conversations are important for us to understand from the experts themselves. So doctor, that brings me to my next question, which is basically the difference I want to understand between asthma and allergy, because I believe both are usually, either used interchangeably, or as mothers we don't understand. So if you could tell us, please.
That's an excellent question. So, allergy is nothing but our body unnecessarily reacting for harmless things in our environment, like your dust or pollen or even food for that matter.
Correct.
So, that is allergy. So, it's something our body reacting to something that's very harmless. But if this allergy is happening in the airways, and if this allergy is causing some airway inflammation, mucus production, and narrowing of the airways, this allergy in the airways is called asthma. So that's the difference between allergy and asthma.
Okay, thank you so much for clearing that for me, doctor. Now, the second I think about asthma, I think any parent, in fact, we start thinking or imagining inhalers and syrups and whatnot, right?
Yes.
So, inhalers, please tell me, I mean, I would ideally stay away from an inhaler because that worries me. So, which is better, doctor, an inhaler or a syrup in case of asthma?
So I think the whole panic around asthma word come from this inhaler panic. So
Correct.
everybody has this panic around inhalers.
Right.
So if you ask me, inhaler is good or syrups are good, inhalers are very safe and the
Oh.
most effective medication that we have got in our hands
Wow.
since at least 6 to 7 decades for treating this problem very effectively. So
Incredible.
why inhalers have very less dosage, very less dosage compared to your syrups or even your nebulizations, and unless your syrups will go into your stomach, from stomach it goes to your brain, heart, lungs, kidneys, everywhere, and where it's actually needed only little bit goes, which is not enough, not effective, and may have some side effects. But in inhaler, if you're taking an inhaler, the dose is very less compared to any other drug formulations, and
Interesting.
also it's very local, it's very directed, so the side effects are very less or no side effects, and it acts very beautifully and you can see the difference in no time. So if it's very safe, very effective with no side effects, then why not?